So finally, the inflammatory factors which lead to acute inflammation, COVID-19, has been identified and isolated in a study done at Children's Research Center in Memphis, in US. The study reveals that TNF, tumor necrosis factor, alpha and gamma are primarily responsible for cell death during the cytokine blast and resultant inflammation, COVID-19. These two cytokines, of the 8 identified cytokines, is primarily responsible for cytokine blast in COVID-19 and resultant inflammation and cell death. The kind of cell death associated with this cytokine blast are actually classified into apoptosis, pyroptosis, and necroptosis. You know what that means? These are big terms. What that means is simple. Apoptosis is a normal kind of cell death which doesn't cause much inflammatory sequel. Pyroptosis is a necrotic type, is the type of cell death where there is a cell rupture and resultant release of inflammatory factors. And necroptosis is a kind of cell death associated with the cell rupture and necrosis. So out of these three, apoptosis is not responsible for a large level of inflammation, but pyroptosis and necroptosis is, of course, responsible for the acute inflammation and sometimes a mortal or fatal prognosis in COVID-19 severe cases. So now further studies required in this direction.